The emergency coordinator of the departmental hospital explained how the process of care of patients who arrive at the service with respiratory symptoms is carried out, informing when these patients are sent to intensive care unit or when they only require complementary oxygen.
Entonces la puerta de entrada, como muy bien
At the door of delivery is Dr. Mendez, who receives all those that are admitted and says this one should go to the ICU. The team that is in intensive care must see to it that the patient holds up on his own. In that way, avoid taking the patient to the intensive care unit and avoid using mechanical ventilation. Then once it is defined, the patient is admitted to the internal medicine, then eventually goes to the intensive care, or even cases that we have dealt with goes directly to the morgue. 2 positive patients have arrived drone that unfortunately have died.
The department's specialists are amazed at how COVID-19 significantly affects the lungs as they analyze the scan that they perform on patients who arrive at the hospital to determine if they should be intubated and take it at once on the intensive care unit.
Lately, the consultations of patients asymptomatic respiratory in the service of emergency have increased a lot. We have designated 2 doctors to take care exclusively of those type of patients to determine immediately their admission. Those who require complementary oxygen or care in the intensive unit, the medical team and all the disciplinary equipment with which we counted in the emergency department once the patient is infected. Then the pertinent tests are ordered to him and the caring route indicated by intensive care unit, emergency or internal medicine.
After this situation, the doctors call on the community to abide by all biosecurity measures and practice self-care.
All you see is an impressive inflammatory process, and that is not a virus from Australia or Europe. This is an image of a patient from San Andres admitted for coronavirus. This is what we are facing, so people do not measure the seriousness of the situation, so they are very calm, very relaxed, but we as doctors see some images like this and are very scared. That patient needs to be intubated quickly and check the clinical condition of this patient. How is he oxygenating? See if he is having difficulty breathing, if he is very anxious, with some blood tests that are altered. And with that image, one says we need to intubate this patient there and then call the intensive care unit team so that they can intubate and take the patient to the intensive care unit.